Malaria by Maddie Smith and Kara Stonecipher. Malaria is caused by a microscopic single-celled organisms that live in the bloodstream found inside organisms. Malaria is a eukaryote, more specifically a protozoan with metabolic capabilities. The metabolic capabilities are shown through hemoglobin, which is the iron-containing oxygen transport metal protein in red blood cells of vertebrates. Hemoglobin is an important nutrient source for malaria organisms. The metabolism of hemoglobin causes degradation to occur, which is a pivotal role for the malaria vacuole digestive system. Malaria lives as a parasite in two organisms found in monkeys and mosquitoes. This being said, the parasite can only be passed on to other organisms by a mosquito. Pyrophosphate is a membrane protein found in plants, bacteria, and protozoan parasites. The protein is important to maintain the proper balances of ions in cells. For parasites, pyrophosphate help maintain a proper ion balance that allows the protein to be able to invade and live in organisms. There are 4 steps to the life cycle of malaria. The first part in the cycle is called gametocyte, which is the form that infects the mosquito and reproduces itself as if it were both sexes. When the mosquito sucks blood containing gametocytes, the blood passes through the salivary glands of the mosquito, where they develop into a new form called sporozoite. Sporozoite can be passed on to humans when bitten by a mosquito. When the bite of a mosquito infects its saliva into blood vessels, the sporozoite moves with the blood to the liver and enters the liver cells. Once within the liver, some of the sporozoite divides and becomes thousands of merozoites. Merozoites are released from the liver to the blood, where they are taken up by red blood cells. Once taken up, many turn into ring-form trophozoites and split again to form schizoids. Schizoids burst the red blood cells, releasing the merozoites.
Malaria is prevalent in the tropical, subtropical, and poor areas of the world due to lack of medical resources. Currently, anywhere from 300 to 500 million people contract malaria each year, and 3.3 billion people live in at-risk areas for malaria. There are approximately 247 million cases of malaria each year, and 90% of those are found in sub-Saharan Africa. Every 30 seconds, a child dies from malaria, usually in parts of the world where access to the proper drugs is limited. In rural areas of West Africa, the mortality rate of infants is 6.3 per 1,000 in infants and 10.7 for 1,000 in children that are aged 1 through 4 years old. Globally, the morbidity rate shows that currently there are approximately 300 million people that are affected by malaria, and out of the 300 million, about 1.2 million die per year. The main reservoirs of malaria come from chimpanzees and gorillas, according to the World Health Organization. The most common mode of transmission is through the mosquito bites. The disease can only be transmitted through female Anopheles mosquitoes. However, some other modes of transmission include an infection from a mother to an unborn child, through blood transfusions, or by sharing needles, because the disease is found in the red blood cells of a human.
Malaria can give people different symptoms, but almost everyone gets a high fever. Malaria is a parasite that lives inside your body's blood cells, and once it gets there, it grows and multiplies for 2 days, where 16 to 32 new malaria parasites are made. These new parasites then burst out of the red blood cell, destroying it, and can go and find other red blood cells to infect. Malaria causes a loss of blood, anemia, and it can also stick in the brain and cause seizures and comas, and has also caused issues in the lungs, making it hard to breathe. A serious case of malaria can cause death, especially to children under the age of 5 and pregnant women. The time from when you are infected with malaria to when symptoms are present typically range from 8 to 12 days. However, different strands can take longer to show symptoms, such as 18 to 40 days in extreme cases. Common symptoms of malaria are fever, chills, headache, sweats, fatigue, nausea, vomiting, dry cough, muscle or back pain, and an enlarged spleen. Not all of these symptoms will be present. It depends on the patient and the strain of the virus.
First, after the infected mosquito bites the human, the parasite called Plasmodium travels to the liver and begins to rapidly reproduce. Although some of the parasites remain dormant for an extended period of time, many immediately enter the bloodstream and continue to multiply. Plasmodium is a tricky parasite. It attaches, lives, and continues to multiply in the red blood cells where the immune system can't catch it. The red blood cell becomes full and bursts because it can no longer contain the plasmodium. After bursting, the immune system has the chance to attack the parasites. Some get caught, but others have already spread on to the neighboring red blood cells, entering them and beginning to multiply as well. The majority of the deaths and severe effects of malaria occur in children due to the fact that their immune systems are weaker than adults. They are still developing and don't have the ability to produce powerful anti-parasitic cells like antibodies. The bloodstream becomes filled with these parasites, and the mosquito that bites the human next will contract malaria, then spread it to the next human it contacts. Treatment of malaria depends on many factors, like how severe the case is, the person's age, weight, if they're pregnant or not, and where in the world the person affected is living. Treatment length and the types of drugs used will vary due to the situation. It is ideal for someone who is infected with malaria to be treated as soon as possible. Many common anti-malarial drugs are chloroquine, quinine sulfate, hydroxychloroquine, mefloquine, malarone, and proguanil. Anti-malarial drugs are used to help reduce the symptoms and eventually cure the disease from your body, only if proper treatment is taken. There is no vaccine available for malaria. Mild malaria is able to be treated with anti-malarial drugs that people can take orally. On the other hand, severe malaria usually needs to be treated in the hospital or clinic with IV drug treatment and fluids. There are many precautions that can be used to prevent or significantly lower somebody's risk of contracting malaria. For example, when traveling to foreign countries where malaria is prevalent, it is beneficial to wear long clothing items, especially in the morning and evening when mosquitoes are more prone to bite. However, if it's a hot climate, no one would want to dress in long clothing items. So in that case, mosquitoes are less attracted to lighter colors than darker. Using bug repellent as well as taking anti-malarial medicine before traveling to a country where there is a high risk for malaria will decrease someone's chances of getting malaria.
An eradication campaign was started in the 1950s, but it failed globally because of problems including the resistance of mosquitoes to insecticides that were used to kill them, the resistance of malaria parasites to drugs used to treat them, and administrative issues. In addition, the eradication campaign never involved most of Africa, where malaria is the most common. The campaign only eradicated North America.
Every 30 seconds, a child dies from malaria. Did you know that it only costs $10 to donate a mosquito net to someone in need? Your $10 could save someone's life.